Welcome to Prevention Institute's peer learning forum titled Prioritizing Equity and Community Wellbeing in the Wake of Catastrophic Events. This is part of a project supported by a cooperative agreement with the Centers for Disease Control and Prevention. The views and information provided here do not necessarily represent the official views of the Department of Health and Human Services or the CDC. I'd like to quickly introduce my team at Prevention Institute. So today we're joined by Ruben, Sheila, Alexis, Cami, Shabana, full team here today, and really thankful for all of their contributions. And you'll get to hear from different folks as we move on. Our objectives today are to start by introducing the adverse community experiences and resilience framework to think about equitable recovery and systems change that supports well-being in the long run. We'll share examples of actions to create protective environments, strengthen economic supports, and advance other suicide and trauma prevention strategies. And as you know, this is a peer learning forum, so we want there to be lots of discussion, including on what types of actions are needed to further well-being and intentionally address racial and other inequities. So if you haven't yet, please join in on the conversation, starting even now in the text chat. And we're going to actually have a text chat question for you to respond to right now, which is, what does prioritizing equity and community well-being mean to you in this moment? So this is part of the title of this web conference, and we want to know what really drew you in. Why did you decide to join us today? And what does this mean to you? While you're typing your responses, we'll come back to share them back, but I want to start us off with a quote. It says, "In order to rebuild, we have to address the underlying inequities that made us so vulnerable to the pandemic in the first place." Going back to where we were pre-pandemic isn't good enough. And this specific quote was from Melissa Botich from the National Women's Law Center. And it was speaking more specifically to income security and childcare, early learning, but I think it really applies across systems. And we really have a lot of opportunities right now with recovery efforts underway, including through dollars allocated through the American Rescue Plan Act to address mental health problems, suicide, substance misuse. States and local communities have a real opportunity to set the course for a healthier and more equitable development in the wake of COVID-19. And as we develop strategies to address these issues, including things like suicide or adverse childhood experiences, there is an evidence base around things that work, and we need to listen to our communities and tailor efforts to our communities. But some of the strategies from the research are things like strengthening economic supports, creating protective environments, ensuring a strong start for children, and as you can see, many others. And if you want to learn more about these, you can check out the CDC's technical packages and resources on these issues. But as we address, these issues in our community and maybe even apply some of these strategies, we need to think about them through an equity lens. So which populations do we need to focus on when we're strengthening economic supports? Or what systems do we need to change to really get to the root of the problem? So we're hoping to continue this dialogue as we go today. And the way we will do that is by starting off with Dr. Howard Pinderhughes again, talking about the ACER framework. And then Alexis from my team is going to share some examples of prioritizing equity and community well-being. We'll then zoom in into Houston, the Houston context, and we will have Deborah Moore from the Houston Health Department have a conversation with Sheila Savannah from Prevention Institute to talk about how is recovery coming up in the Houston context. And then, of course, having some peer exchange. So with that, Alexis, can you share what's coming up in the chat?
Yeah, absolutely. So we're seeing a lot about focusing on systems change, thinking about the social determinants of health, a lot about community-led action and nothing about us without us. And sort of making sure that volunteers and others are representative of the population being served. A lot on sort of variations on that theme, but I think folks are pretty consistent.
Thanks for pulling out some themes. And yeah, I see something here on having difficult conversations and acknowledging unjust systems. All very important to be doing. So we're going to continue this conversation as we go and hope that these themes will continue to surface. But I would like to hand it off to my colleague, Ruben Cantu, who is going to be in conversation with Dr. Howard Pinderhughes.
Thanks, Alicia, and thanks everybody for joining us today. So Howard, kind of to get us started, could you share with us a little bit about what is community trauma when we talk about community trauma, and why we need to be talking about and acting on it right now, and generally in the context of catastrophic events like the pandemic?
Thank you, Ruben. I'm gonna go off script a little bit, as you know I do. We're talking about trauma, and right this moment, we would be remiss if we don't acknowledge that the state has killed another Black man, which is one of the clearest acts of structural violence and systemic violence. And so I want to hold up the name of Dante Wright, who was murdered on Sunday outside of Minneapolis. Take a moment of silence for him and the other unnamed men and women who have been victims of police violence. We cannot just go on with business as usual. Okay, I'm gonna try to transition because I'm emotional about this one. It's part of our trauma. This is part of our trauma and part of what we're here to talk about. And when we talk about catastrophic events, certainly we're talking about catastrophic events that could be brought on by climate change or disasters or pandemics. But we're also talking about catastrophic events that happen in the context of our daily lives, that, like we saw in Minneapolis. So when we talk about community trauma, this is a framework and an understanding that we've at the Prevention Institute have come to understand, and it's now being embraced around the country as a way to understand the impacts of structural violence, interpersonal violence, historical and intergenerational violence, and the understanding that trauma is both an individual impact, but it's also a collective and community impact. And that we can look at what happens in communities and understand that there are things that happen at a community level that we can understand as symptoms of community trauma. And this we got from engaging and working with communities around the country through the Urban Networks to Increase Thriving Youth Unity Initiative, where literally every single community as a part of our network was expressing over the last 15 to 20 years that they see their communities as traumatized. And most people were referring to the fact that there were large numbers of individuals in their communities who had trauma, which we all have right this second. But what we also were looking at was understanding that communities themselves, some of the aspects of communities were experiencing a form of trauma that was impacting different aspects of communities that are vital for them to function as the fabric and foundation of resiliency that they normally can be. And this emerged out of our conversation in the Prevention Institute about what is a healthy community and what does it mean to have a healthy community, and what does it mean when we have a traumatized community, and how do we deal with it? And the understanding we emerged with was that community trauma is not just the aggregate of individuals in a neighborhood who have experienced trauma, but we can look at aspects of community, symptoms of community trauma that happen in the social, cultural, the physical built environments, and the structure of educational and economic opportunities. These are three domains of community that we've identified through the Prevention Institute, through our Thrive initiative, which has allowed us to understand what are the dynamics of a healthy community. And we started to ask the question, what are the manifestations of community trauma that happen in these domains that we can start to understand? Not only do they prevent a community from being the fabric and foundation of resilience, but they also function as part of the reproductive process of violence and trauma in a community. And not just violence, but also other aspects of chronic disease, poor health, and premature death. And so as we look at this, we've identified these three domains of people, place, and equitable opportunities as really key and critical to what makes up a healthy community. And as we started looking at traumatized communities, we started understanding that there were symptoms of community trauma we could identify in each of these domains, so that in terms of people, we were looking at disconnected and damaged social relationships and social networks, the elevation of destructive social norms, and low sense of collective political and social efficacy. These are critical pieces to how traumatized communities reproduce the trauma inside them. And again, as I kind of go through these, think about how these aspects of community manifest themselves during the last year of the pandemic. What does it mean in terms of that, how communities either could respond or not respond to the pandemic and the emergencies that arose? But also understand that these are the very same communities that were wrought by the structural violence that gave rise to the movements for racial justice this past 12 months at the same time as the pandemic, which brings us to one of the concepts that we've focused on in our understanding of community trauma, and that is the idea of synergistic trauma. And synergistic trauma is when you have multiple sources of trauma, structural violence, interpersonal violence, disasters, pandemics, which all come together in a synergistic, not just additive, but synergistic way to increase the impact and the effects of these problems. And so as we move through, we look at place and see how the deteriorated environments and unhealthy, often dangerous public spaces and unhealthy products exist in these communities. And then the structure of educational and educational opportunities, which have been undermined through decades and centuries of structural racism and structural violence, which have created situations where communities are unable to respond to their situation. Now, how do we understand that in the context of the pandemic? We all know that the communities that have been most adversely impacted through COVID-19 have been Black and Brown communities, Indigenous communities, poor communities, communities of color that have been subject to community trauma, structural violence for decades and centuries. And that now we have a period where we're focusing on this issue of health equity, and COVID has ripped off any idea that there was any element of equity or equality within the context of our health system, of our economic system, and our educational system. And so with that, we start to try to think about, well, how do we utilize this framework as a way to start to move forward to respond to issues around structural violence and issues around trauma that we can look at exist in the face of both the racism, sexism, heteronormativity, but also issues around economic violence. All of these things exist alongside of some of the impacts of the policies we have on immigration, alongside the impacts of climate change. And we need to figure out how are we going to engage our communities to build their strength, their resiliency, their ability to create the systems and supports necessary for community members to thrive in the face of disasters, of pandemics, of racism, and of violence. One of the things that we've done is to focus these with several different initiatives that we've looked at in Prevention Institute. One is called Making Connections, which is making connections for mental health and well-being among young men and boys around the country. And next slide. Next one. These are the communities around the These are the communities around the country who we've collaborated with to use the framework as a way to address some of the issues around mental health and well-being among young boys and men of color and veterans around the country. And what we've been able to look at is the ways in which communities can build their capacity to address the both physical as well as emotional and mental health of their members through focusing on these three areas, particularly some of the social networks and social supports that exist in communities, but also engaging in ways that reconnect intergenerational relationships as a way to try to restore some of the natural ways in which communities support each other and create spiritual and mental and emotional well-being. Additionally, physical spaces need to be engaged. We've looked at it around the country and have been able to think about how these simultaneous community solutions in each of these domains have allowed us to focus on ways in which to heal communities from community trauma, ways in which to address the specific symptoms of community trauma in ways that restore the physical, the emotional, the spiritual well-being that communities have and the relationships they have among each other that allow for our community members to thrive in the face of adversity. And so as we move through to the discussion for the rest of the day, I want us to kind of understand that the question of how we address and prevent community trauma is focused on thinking about the systems that are at play or in connection to communities. Next slide, please. And how those function to either heal communities and restore their ability to be strong social, economic, and spiritual supports for families and individuals in those communities. And so we look at these different systems in the economy, the justice system, the educational system, housing, immigration, community development and design. All of these systems have a role in whether structural violence is inflicted on our communities, or whether we develop the ability of communities to actually thrive. And part of that, and I think this is important for folks across the country to understand, is how do we keep communities not only healthy, how do we improve their environments, how do we make healthy environments, how do we create educational and economic opportunities, but remembering that when we do this, the market notices, and the market understands that then our communities have been transformed from ones which may be physically dangerous and have elements of violence to ones that are safe, secure, and are wonderful places to live, and then subject to one of our newest forms of structural violence, which is dislocation and gentrification. It's critical that we keep and sustain our communities in place as we improve their ability to function as a fabric and foundation of resiliency. Now, I know you have maybe one or two questions, Ruben. I went on probably too long, but I want to turn it back over to you.
Howard, you answered all of our questions and more, really. And I think the one area where I would want to dive a little bit more into before passing it back to Alexis is kind of as we're kind of looking, just to top of mind for you, like as we're looking at, people keep on saying getting back to normal. And we know, based on what you just said, getting back to normal is not ideal for a lot of folks, especially the folks that have been most impacted by the pandemic and all of the other synergistic traumas, like you were just talking about, like the state killing that happened on Sunday. So how can we make sure that as we're thinking about recovery and as we're thinking about trying to recover from the big trauma in the room that we're talking about being the pandemic, what do we need to do especially with these systems, to make that recovery both equitable and long-term? It's a big question.
Yeah, and there's a lot to that answer. I'm not going to be able to go.
And you got 2 minutes to answer it.
Right, and so I'm going to just pick a couple of pieces.
Yeah.
To that. The first place I'm going to go is to engage and center our young people in our solution, because over the last 12 months, they have supplied the energy and the vision for what our society should be and isn't in the current day. And they've provided a lot of our conscience around what we need to be doing around issues around racial equity. And so as we move toward this idea of normal for a lot of our communities is higher rates of mortality, higher rates of death, higher rates of disease, higher rates of violence, all of these pieces, that's what we're talking about normal. It was astounding that as we started to open up our society and we started to go back to quote unquote normal, that one of the first signs of normality were mass shootings across the country. This cannot be the normal we return to. And so part of what I'm saying is that being able to engage communities and center the idea around equity in everything that moves forward in terms of how we do this. We've got a national initiative on pandemic response right now. There's money that's going to be flowing down. There's infrastructure, talks about infrastructure bills. These have to be connected to policies around equity and around where they get directed, around the communities that benefit, around who, because right now people are lining up at the trough of public investment, and we've got to figure out a way at the local, the state and the federal level to take the energy we have from the last 12 months for racial justice and inject it into virtually everything we do in terms of recovery.
Howard, thank you so much for kind of helping set the foundation for our conversation today. I think a lot of what you've said, I'm hoping really resonates with folks, and they recognize it. They recognize what's happening in their communities as a really deep need for action and for forward momentum. So thanks for sharing all of that, and we'll check back in with you a little bit later on in the peer learning forum as well. But for now, I'm going to pass it over to Alexis.
Thank you, Ruben and Howard. Before we hear from Deborah and Sheila, we want to share a few examples of how agencies and organizations have strengthened community conditions, including during the COVID-19 pandemic. And as we go along, Cami is going to drop links in the text chat that provide further information on the examples. So our first examples center on community connectedness and civic participation, because we know that social connection is protective against both trauma and suicide. And we're going to skip this slide and perfect. In times of crisis, community members often turn to existing social infrastructure. So trusted local groups and institutions that already serve as connection points. During the COVID-19 pandemic, grassroots nonprofits and community-based organizations have stepped in to fill gaps and have pivoted to help meet their community's needs. For example, this photo is from Kokua-Kalihi Valley Comprehensive Family.
You're on mute.
If you go back to the previous slide, for example, Kokua-Kalihi Valley Comprehensive Family Services in Honolulu converted the warehouse that normally houses its youth bike shop into a food hub during the pandemic in response to widespread job loss in the Kalihi community. So that's one example of how organizations have pivoted to meet their community's needs. And then in St. Louis, even prior to the COVID-19 pandemic, a city-county partnership has leveraged the SAMHSA Recast Grant, or Resiliency in Communities After Stress and Trauma, to create community change and promote healing using a participatory approach. So all of the community projects through Recast St. Louis are awarded through a participatory budgeting process, meaning that residents vote to decide how to spend the money. So an example of civic participation. And then as we move to the physical and built environment domain, we have an example that's at the intersection of the built environment and the sociocultural. The recently released report, Resilience Before Disaster, calls for the development of resilience hubs, which is on the next slide. And these are physical spaces where communities gather, organize, and access social services on a daily basis. And they also provide response and recovery services in disaster situations. So the report highlights RISE Youth Center in Richmond, California as a model. And RISE, part of what RISE does is connect youth to caring adults, which is one of the strategies in the CDC's resource document on preventing ACEs, which Alicia had mentioned towards the beginning of the webinar. We've also seen during the COVID-19 pandemic efforts by local, state, and federal at the local, state, and federal level to improve housing stability during the COVID-19 pandemic, such as emergency rental assistance, which is represented on the map on this previous slide, and also eviction and foreclosure moratoria. So we know that housing stabilization policies can help to reduce suicide risk. And while many of the COVID-related policies are intended to be temporary, there are implications for program design beyond the pandemic. So for example, in February, the Department of the Treasury released guidance that gives grant programs wide latitude in the types of documents they can accept to prove that an applicant qualifies for rent relief. So that includes written attestations to prove COVID-related hardship, because there's a lot of reasons right now why people are unable to produce official income statements or leases. So this, again, is shifting the focus from preventing fraud to quickly getting money into the hands of the people who need it most. And then finally, as part of preventing trauma and promoting healing, we can go to the next slide. Communities are pushing for more equitable distribution of opportunity and of resources. And so one example is through strengthening household financial security, which has been shown to reduce the risk of both suicide and ACEs. High quality childcare is specifically included in the CDC's resource document on preventing ACEs. And the report Building Our Care Infrastructure, which was released in the fall of 2020, explains how the COVID-19 pandemic has exacerbated this financial strain felt by parents and caregivers, especially Black and immigrant women who disproportionately provide care for others' families as well as their own. So the report lays out a blueprint for moving forward, including actions such as securing universal access to childcare and paid leave, and raising the federal minimum wage. Shabana, we can skip the next example. And I think we'll go ahead and wrap here. I want to hand it back to Alicia and make sure that we have time for the conversation with Deborah and Sheila. I know this was a whirlwind, but we encourage you to go back and look at the examples, including the ones that we skipped over, just in the interest of time.
Thanks, Alexis. Yeah, I think those examples really help us see what actions in people, place, and opportunity can really look like. And we have shared the slides in the chat if you want to go and learn more about some of these examples. One thing that really stood out to me across them is the importance of partnerships. All of those examples, really required more than one group, and really required community partnerships, especially for when government agencies are taking action, the importance of elevating community voice and all of that. And so I want to now zoom in to the Houston context, and would love for my colleague Sheila to introduce Deborah Moore.
Hello, everyone. It is my sincere pleasure to be able to introduce you to Deborah Moore. Deborah is the Deputy Director of the Houston Health Department. She oversees human services, which includes the Area Agency on Aging, Maternal and Child Health, which includes WIC, Nurse Family Partnership and Healthy Families, and the chronic disease programs of the department. As you can see, many of the areas of the department that Deborah leads reach into and support Houston's most vulnerable populations. In the past, we have worked for a long time together, both as work colleagues and then just also as someone whenever there's a need to think about both the immediate response to urgency as well as the long-term change that I call on. So I'm just pleased to be able to bring Deborah into this conversation with all of you as we look for long-term solutions. So welcome, Deborah.
Thank you so much, and thank you for inviting me to participate. I've just gleaned a wealth of knowledge already, so I'm excited about this opportunity.
Yeah, I mean, these peer learning forums have been really built on how do we exchange across the country the kinds of solutions, because I think that when we're talking about the urgency of social justice and racial justice and health equity, we really have to also robustly get in dialogues with each other to say, what do we struggle with? What do we change? Can you just set the context? I see you're joining us from the George R. Brown Convention Center, but can you just set the context of what the past year has looked like in Houston, especially across multiple populations?
I will endeavor to do that, Sheila. But before I do, let me just say that Sheila has been a very special person to me personally and professionally. We do go back longer than either one of us care to admit, but so happy to work with you again, Sheila, and always the connection is always there. So, but I will endeavor to talk about the last 13 months, which have been to me like the movie Groundhog Day. I never did like that movie because it just is never ending. And that's sort of how it has felt for the last 13 months. You are right. I am at the George R. Brown Convention Center. We actually stood up a call center here in 1.5 days. We stood up a call center. We brought on 60 agents, and we are working with those very populations that we're discussing now. People that are vulnerable, individuals that are basically disenfranchised. We're working to schedule appointments for those people to receive the COVID vaccine. So just a little bit of background. Our first COVID case was confirmed in March of 2020, March the 5th to be exact. And that case was associated with a cruise, a European cruise, actually an Egyptian cruise. The next several cases that we saw were also associated with that travel. But on March the 10th, we saw our first non-travel associated case, which actually confirmed community transmission. Since March the 10th, we have worked to address the growing rate, the growing positivity rate, the growing rate of illness, sickness, hospitalizations, and the lagging indicator ultimately is death. After that community transmission case, Houston actually closed, I think for the second time in history, the Houston Livestock and Rodeo, which is a significant major grossing event for the city of Houston. This really did indicate the seriousness of this virus. After that, other state and local restrictions soon followed, the closures of organizations, of companies, and also employment. We worked through that initial surge, and during the fall, we saw our positivity rate drop to about 5%, and we thought we could then exhale. It turned out not to be true. We experienced another surge in the winter, and this surge was actually worse than the initial surge. So we are working through that now. We are starting to see our numbers drop again. And we're hoping with more people vaccinated, we have experienced our last surge. We are still emphasizing social distancing, wearing of masks, and taking other sanitation procedures. So basically what I would say is we are a community in healing. We have seen in this community people that understand the need to take those precautions. But again, we do still have work to do because we still have individuals that feel that those precautions are unnecessary. We, the Houston Health Department, are still emphasizing social distancing. We are still emphasizing taking all of those procedures. So basically what that means is that, and I just wanted to make this point, everyone in this community has been impacted by COVID-19. Everyone in this community. Some of us more than others, but just the fact that we have seen our community change within the last 13 months has had a significant impact
Yeah, on the entire community.
on the entire community.
Yeah, with a city and a metropolitan area that is so diverse, we know that Houston has a multitude of ethnicities and languages, and just I would say areas of the city that are harder, that are more isolated from population, from health, and accessing those kinds of health opportunities, kind of like what Howard outlined in terms of structural trauma. Talk to me about trusted messengers in those communities, and how do they play into really having a full city response?
So, one of the things that we have recognized is that, as I said, everyone has been impacted. However, some of our most vulnerable residents and communities have borne a much greater impact of the COVID-19 burden. So we've seen throughout these communities a significant increase in domestic violence and abuse. We've seen an increase in alcohol and substance abuse, depression, crime, homicide, and suicide. So in response to these behaviors, we have reached out to the trusted voices in these communities. We've reached out to our partners in these communities to, first of all, outreach these communities in an effective and a meaningful way. Someone said earlier, nothing about us without us. And I am such a proponent of that. So we, first of all, have to hear and listen. We have to hear from these communities. We have to understand exactly what the need is as it is reflected through their eyes. So we reached out, as you said, we have several mayors, we have several community mayors throughout Houston. These are individuals that are really what we call trusted others in the community. We initially spoke with them. We received their input in terms of what is needed. What should we bring into the community in order to assist the community in recovery and in resiliency? We partnered with community-based organizations. We partnered with faith-based organizations. We are continuing to do that. We initially started by having our traditional clinics, and many of our clinics are in these communities. We initially started by providing services through our traditional clinics and our multi-service centers. That was always available to community residents. What we realized eventually was that we had to get closer to the community. We had to go to the places where the community residents go, where they congregate. So we actually now go into those communities. We go into the barbershops, we go into the washaterias, we go into those communities, we talk with the residents, we offer them services, we offer them the opportunity for testing and vaccine. We will bring our clinics into the communities. We will allow the trusted voices to express to the community residents that it's okay, that initially, first of all, we are not going to check citizenship, which is a big concern here in Houston. We're not checking citizenship. We're not running license plates. We're not doing anything other than bringing services and supports in your community to assist you in a healthy recovery. So the partners have been essential to the work that we do. And when I realized that we were going to be talking about partnerships, I wanted to quote our director, Stephen Williams, who is probably one of the greatest advocates for partnering with community-based organizations and trusted voices. So if you give me a minute, I'd like to just read his statement. Sure. Because I think it really does speak to the philosophy of the health department. So basically, I asked him, I've seen you throughout the years really emphasize working in the communities and working with community partners. So can you give your perspective on the importance of working with community partners? And basically, he said, we are willing to accept what people are willing to give. We partner with organizations and individuals in the community, but we do not lose our soul. We ensure that our relationship with our partners mirrors our values, and we ensure that perfection does not get in the way of good work. We stand to work with our partners and to build capacity in the communities.
Wow. Yeah, I think some of what I want to lift up in that quote, in your work and having worked in the health department, it's a special kind of partnership when you can yield to listen, but not let go of accountability for health. And I think that's a unique kind of relationship where you have public agencies that are still willing to be accountable for making sure that the job is done while they are really intentionally listening and responding to changing needs. I know we're going to go into breakout rooms, but if I can ask the team to indulge us, I know one thing that you mentioned on our prep call is you are there with a call center because technology, as we move to the efficiency of technology, we cannot assume that that is a good solution for many of the communities that we're focused on. And so hopefully in the breakout rooms, you'll be able to delve with those that you're gathered with into that a little bit more. And then also I look forward to hopefully talking with you as we reconvene. And with that, I think I'm to turn it back over to Alicia.
Yeah, thank you both for sharing and letting us listen into your conversation there and hearing about trusted messengers and community networks, the importance of those. Those are conversations we want to continue in breakout groups because we know that within this group that's here today, there's so much expertise that we can all learn from. So we're going to get into some breakout groups, and we have 3 questions that we'll be diving into. The first one is around what actions have community networks, organizations, or local government taken during the past year to support well-being, and how do those center equity? What does equitable recovery from the pandemic mean to you in this moment, building out from that initial question that we had as a text chat at the beginning? And then further about networks and partnerships, how do we build community networks and connectedness in advance of disasters? So we will now get into our breakout rooms. And Cami, I will let you, thank you, move us there. Welcome back, everyone. I know that time went pretty quickly for my group, but appreciated being able to engage in a bit of a conversation. So thank you for sticking around and partaking in our breakouts. So feel free to share in the chat anything that resonated with you from your small group discussion. And while you're doing that, I want to ask Sheila from Prevention Institute and Deborah Moore from the Houston Health Department to share some closing thoughts. So I'm going to hand it off to Sheila.
Thank you. Thank you. Such a good discussion. And thank you, Deborah, for rejoining us here as we really think about some of the permanent changes that are occurring that I think will be able to help address just the ongoing need for more racially just health equity solutions, especially as we look at infrastructure disruption. And so I'm calling Deborah. Deborah, did you hear, or what were your thoughts on some of the longer term solutions that were discussed in your group?
In our group, I really liked the statement community cares. We talked about how, we have implemented things, we've put things in place to be responsive to the pandemic and the impact of the pandemic, the unemployment, the long lines for food, the threat of possibly becoming homeless because you can't pay your mortgage or your rent, you need utility assistance. So we put things in place to address that. The statement was, and I cannot support this more so, is that I hope it's not a short-term fix. These things are, have just been illuminated because of the pandemic, but they've always been there. And if we have been able to actually put services and programs in place, we've been able to set aside the bureaucracy and all of the rules and all of the paperwork so that we could be more responsive in a more timely manner in addressing this. Why can't we continue that? Why can't we continue that community cares philosophy that actually will then bring equity and access to the very neighborhoods that we're talking about?
Yeah, I think that's so important. Some of the solutions that came up in breakout group 3 were the expansion of substance abuse treatment facilities that were needed anyway, and how also pop-up clinics in places that needed increased access to resources. And so I think that this is really a drive toward finding permanent solutions. Like you said, the pandemic has illuminated some of the inequities that have existed and that continue to create barriers to health and well-being and safety in a number of communities and populations. And so I think this is an opportunity to look at how do we cut through in disasters and then use those mechanisms to really continue to cut through structural racism and
Absolutely.
ineffectiveness. Yeah.
Yes. And if I can, I just close with the one personal observation for me here in Houston is that I'm seeing more, I actually am seeing people that are in positions to make decisions, to put systems and services in place, listen more frequently, actually hear from the community and listen to what their needs are, not just decide for the community. That's another thing. If we can continue that level of conversation, if we can hear the voices in those communities, in our communities, and be more responsive to that. I've seen that through this pandemic, and again, if we can just continue the conversation and continue to address in a more equitable fashion the needs of those communities. And I think we have some good building blocks. We've put some things in place that will allow that to happen.
Yeah, excellent. I know, Alicia, we wanted
Yeah.
to also have some time to hear from some of the other breakout groups.
Yeah, I'm wondering, Cami or Alexis, Ruben, anything to share from your groups?
I'll like piggybacking on Deborah's last comment there. One of the things that we were talking about in breakout group 5 toward the end of the discussion was around, community knows best the needs and the solutions. And a lot of times, maybe community members don't know exactly how to get those solutions implemented, or what the actual lever is to do that. But if we have community members that are working with community networks or community organizations that do know, oh, for that challenge and for that solution, we need to go to the planning department, or we need to go to the health department, or we need to talk to this, to this agency. That's the kind of solution finding that will work best. Rely on community to know the answers, and work with trusted community partners and organizations that know where to go for the answer, where to go for that solution.
That's a good point, Ruben. I mean, and so often it's also keeping a conversation going, so that it's not just listening one time or listening in the time of disaster, but having that ongoing relationship and rapport that, one, allows you to respond to anything that impacts a city, but also it's not just about response, it's about relationship. I think that's really valuable.
I think that's definitely a theme across the Jamboards that I'm seeing right now. Cami or Alexis, anything else that came up in your groups that you want to share?
Yeah, I think everybody kind of spoke to it already, but I think folks in group 4, we really just highlighted that this pandemic has shown that governments are nimble, are flexible, and so we need to hold them accountable to sustaining those long-term equitable recovery solutions. Yeah.
Yeah, we had a lot of good stuff come up in the group, and I would encourage everyone to check out the Jamboard. One thing I wanted to elevate that kind of really aligns with what Sheila was saying about kind of how do you sustain, how do you keep listening. Deborah Drake and Contra Costa shared this analogy, thinking about recovery and thinking about moving forward and what's needed, that it's like when someone passes on, and the first, the day of the funeral, everybody's there. But then the next day and the next month, when people actually kind of might need you the most, sometimes there's a drop off. Often there's a drop off. And so I think our whole group was like, wow, that's a powerful analogy for just when we think about this, even though there's kind of fatigue, I think we need to kind of keep pushing and understand that people are going to be, needing support for the long haul.
Yeah, that's a really powerful analogy, and I'm seeing a lot of agreement in the chat around more patience to reach through the layers to find resolution, more long-term trust within organizations for grassroots. So yeah, and I do want to also circle back with you, Howard, and get your kind of closing thoughts and anything from your breakout group. Also, what recommendations you might have for local leaders who are trying to prevent adverse community experiences, ACEs, and suicide as part of an equitable recovery in the long term.
First off, I'm going to cop to the fact that I was not in my breakout group. I took the time to engage some folks who I'm working with in Minneapolis around some of the things that are going on there. But I do have a couple of thoughts. And that is that this is an issue of long-term building of relationships and systems and transformation. You know, we were in the middle. We were in the middle of an initiative in San Francisco that I've been working on called the Anchor Institution Initiative at UCSF, which has really been around trying to transform the way in which the University of California, San Francisco does business and utilize the awesome infrastructure of the financial institution that is essentially a biomedical corporation to provide opportunities for the most vulnerable and the folks who have been most impacted. And we started this about 4 or 5 years ago. And it's been a building process and a process of engaging community, placing community at the center. We've got a board that is half community led and driven and community has true power in terms of deciding how we do this work. And I mention that because part of the lesson we've gotten from the last 10 months is that we did this work over the last 4 years to meet the moment that we had over the last 10 months. And we've had a moment over the last 10 months of both in terms of COVID and pandemic, as well as racial violence and racial justice movements, where we've had people who are proclaiming the importance of systems change and institutional change. And part of our challenge is to understand what it takes for us to sustain this moment, move forward, engage communities in sustained relationships that help to reframe the way we not just do financial business, but the way in which we do the work together in community, in cities, in counties across our states. And that's really part of our challenge is as these moments recede and we get back to normal, the question is, how do we make sure we're not back where we were and that we are moving forward to a new place, a place that has equity in the center? And the way to do that is to really start to build these pieces out. We've talked about the sectors that need to be involved. And those sectors include every aspect of a city and municipal and county government, as well as state government. It also, however, it includes the business and corporate sector. They have a huge role to play and a huge responsibility, because essentially what we've done is let the market do what the market does, rather than take some mindful action within an economic sphere and within our educational sphere to shift and change the way our systems work for our communities, and move those systems and move our institutions to a place where they now are restorative, they're healing, they're building, they're helping to reconstruct and participating in the vision for how our communities can be well, that psychological, emotional, and spiritual well-being can be maintained by individuals as well as communities.
Thank you, Howard. And I think we should just end with Howard, since those were such powerful words. We are going to drop something in the text chat for a question to all of you around what next steps would be helpful in advancing your work. So please share. And we have a bunch of different resources that are on the slides, and we will also share out a full resource list, but just a couple of quick examples of what's going to be on that. Again, the technical packages are there for your reference. We also have the National League of Cities has a report on advancing systems change for equity in triple crisis. And also a COVID-19 policy playbook that has a section on promoting mental health and well-being in relation to the COVID-19 pandemic. So I'll stop there. There's also a few other resources there for you, but want to thank you all for joining this peer learning forum and being open to an interactive format and sticking around till the end. So thank you all for joining us today.